Hello and welcome to the Imaging Wire Show. My name is Brian Casey. I'm managing editor of the Imaging Wire. Got a great episode for you today. Our guest is Dimitry Tran. He is co-founder of Harrison AI and Annalise.ai. Dimitry, thanks for being with us today.
Glad to be with you, Brian.
So can you tell us a little bit about Annalise.ai? I mean, we've had Angus Tran on before and also Dr. Rick Abramson, but always like to hear a little bit of an introduction to the company.
Yeah, absolutely. I'm one of the two co-founders at ANS AI, which is part of the Harrison AI group. We've been around for 5 years, and we're very excited to celebrate. We're reaching about 6 million patients this year, every year that we're servicing through our technology in about 11 countries. So it's a significant milestone for us as a company. And our two products in AI, which is chest X-ray and CT brain, that has combined about 254 indications cleared globally. Is very exciting because it is a comprehensive portfolio on the two largest modality in radiology, which is chest X-ray and CT brain.
Okay, awesome. Well, happy birthday. Chest X-ray and CT are two of the main modalities that you have products for. What are some of the clinical applications that people can use your AI solutions for?
Great question, Brian. I think this is the area that we look to differentiate because with our chest X-ray and CT brain, we cover all the medical conditions that the radiologist or clinician would look for in those two modalities. So it's not just lung nodule or pneumothorax on a chest X-ray, but it's including everything that a radiologist could search for. Something like a dislocated shoulder or free gas in the abdomen or a line in tube. I think comprehensive AI is really taking over as the next paradigm in healthcare, moving away from narrow AI to something that is broader. Up to this point, radiologists use selective AI to search for specific things. I often compare that to a spell checker that check only for A or B, and then the radiologist is on their own for C, D, and to Z. I think what radiologists are looking for is an A to Z solution, and that's what we're offering with 124 findings on chest X-ray and 130 findings on CT brain. We are also working on our third product, which is AI for CT chest, that will become available from mid next year as well, taking the same comprehensive approach.
Is it challenging to develop that many indications for a single algorithm? Because, as you point out, a lot of the traditional AI algorithms that we got our start with were did one thing, like AI for breast cancer or lung cancer or something like that. I mean, how are you able to get to develop so many different applications?
It is very challenging, Brian, because if you look at the distribution of the prevalence of the findings on any modality, so if you take just X-ray or CT brain, the most commonly occur findings happen very frequently, but then it is a long tail distribution, meaning that as you go to the right, the prevalence is a lot lower, meaning that it's a lot harder to find enough examples of rare findings to train the AI for those specific findings to become performance. And on top of that, you need to take the whole portfolio through regulators like CE, MDR, and the FDA. So it's getting very hard to get something that is comprehensive to the market. And that's why, to this day, to my knowledge, I think we are the only one that offer comprehensive AI at the moment because it's very hard to get into those rare findings. But that is exactly what clinicians looking for. At the moment, I think there's a buzzword around the AI world, which is point solution fatigue. There's just so many CIOs and CMOs that I'm talking with. They're saying that I cannot integrate hundreds of algorithms into my packs, into my wrist. That it's just an impossible task. And I think they are looking for something that is more of a one-stop shop.
Interesting. So being able to just have a single algorithm might be easier than having to choose from like multiple ones for all the different applications. Does having such a broad range of clinical indications, does that change how clinicians use your algorithm, or does it change like the environment in which it's used? Because I imagine that a clinician might want to use your algorithm for cases where that maybe are a little more challenging, where the diagnosis isn't immediately obvious versus like let's say lung screening where you're looking for cancer. Does the way that they're using your algorithms change compared to maybe other AI developers?
I think the way that we develop a solution is to cater for every care settings. If you take something like a chest X-ray, it is used in lung cancer screening, like you talk about, all the way into ICU to looking for pneumothorax pleural effusion or misaligned nasogastric tube. So the range is very broad. And a CIO or CMO who procure this type of solution need to factor in all those scenarios because there's not enough return on investment just to procure AI for a single service line within the hospital. So by having a comprehensive AI, we enable our customer to pick and choose from an a la carte system. They can say, I'm a lung cancer screening department. I want to turn on all of the nodules and all of the findings that I care about. And then in ICU, I can say that let's turn off a few other things, but I really care about nasogastric tube, for example. So by being able to customizing our solution and enable them to turn on and off 124 dyes for something like a chest X-ray or 130 dyes for a CT brain, we're really catering for every care settings and make it more cost efficient as well for hospital to procure our product.
So then you can really kind of tune that spell checker to just detect the words you want to detect, to use that analogy. So Annalise has been really successful lately in landing contracts in the NHS, and I know that there was something that came out just recently about a big, I think it was chest X-ray installation that you landed. Can you talk about that a little bit and what's going on over in the NHS with AI? Because it seems like they've been really aggressive with it.
Yeah, the NHS has been really leading the world in terms of the adoption of AI, in particular radiology AI, because they're seeing the potential for this to help with the very overstretched workforce that's currently is a major issue globally, but definitely in the UK. So NHS England last year launched what they call AIDF, AI Development Fund, which is a funding program that enables NHS Trust and Imaging Network, which are groups of NHS Trusts to come together to procure AI and on a public tender. This is in fact the world's largest AI tender up to this point, represents something like over a third of patients in the UK, in NHS England, which is 2.8 million patients in a large tender. And I think the vast majority of those trusts and volume, 83% in fact, has been selecting our technology for that tender. So it is a very clear example where customers on public tender, when they compare directly all the solutions that are available globally for chest X-ray and pick the best solution. This is also a very challenging deployment as well because NHS have various different packs, different risk systems across all the network that have selected our solution. So we have been able to deploy to more than half those trusts now and on the way to finish by the end of the year to over 120 hospitals across 40 NHS trusts. This is a big win for us, but certainly a big responsibility that we take very seriously to care for a third of patients in England through our technology.
Oh, that's great. So, how are some of those deployments going? I mean, what are the hospitals finding with using your AI tools?
You may have seen some of the media that and quotes that the trust like NHS Manchester Imaging Network and various NHS has put out in the recent weeks has been very positive because the clinicians seeing this very much like a second pair of eyes, helping them to pick up the cases where they otherwise would miss. And many of the trusts have run retrospective study on the first few weeks of deployment of their previous case in the last 5 years that they have missed lung cancer on chest X-ray. And what they're saying is over 95% of those cases would otherwise have been picked up had our AI has been around at that time and would have saved months and months delay for patient in getting earlier diagnosis. So we're very excited about the work and the result as it's coming through, even within the first 1 or 2 months of the product being deployed. And we're very excited to see how they take the tool forward because the tender was very specific on lung cancer screening. But what they are finding is that now that they turn on a comprehensive product, they can use the AI for many other things. So beyond the scope of the original tender, which is lung nodule, they now are using our product for bone disease, for airways disease to help the patient to screen for chronic conditions. So this is very exciting to see a clinician experimenting with our product.
Wow. Do you see the AI fund? So it sounds like you feel like the AI fund has been successful in kind of jumpstarting AI in the UK. Would you say that it's working as people had hoped?
I think the NHS has been very good in terms of the way that they design the program. So if you look at NHS, this is not the first adoption of AI in NHS. there has been various trusts that are innovator who adopting the AI for the last few years and generate the evidence that then inform a large tender. I think just like any health system, you want to experiment in a small way first before having such a large rollout of AI. We've been working with trusts like an NHS organization like NHS Grampian in Scotland for close to 4 years now to generate the evidence to help to inform the wider adoption that we're seeing. So it's like most things in healthcare, things happen slowly and then suddenly. So you need to be part of that journey when the big tenders come out.
That's great. Do you see something like the fund as something that would be useful in the US, for jumpstarting AI, or are the health systems just too different?
I think healthcare and a lot of healthcare procurement of new technologies are very much dependent on funding model and reimbursement, as you know. So the AIDF fund is a great model, and that fits into how NHS is funded, which is a public system by and large. Whereas in the US, healthcare is funded very differently, as we all know. And I think reimbursement is very key to unlock the adoption of AI in the US market. We're talking today, I'm dialing from the US and I'm moving to the US actually. So I'll be based out here from next month for the next few years, because this is a very exciting time that we see the US AI adoption is really picking up. And recently we announced that we start receiving reimbursement, New Technology Act-on Payment Medicare reimbursement for one of our indications for CT brain, which is obstructive hydrocephalus, the blockage of the drainage system in the brain, and it's a life-threatening conditions. So Medicare for the next 3 years will reimburse Medicare patient for up to $241 per case for using our technology and for this indication. So we see that it is a key inflection point for us to launch in the US market. When I talk with CIO and CMO in the US, they love to adopt AI, they love to experiment with AI, but they're facing a shrinking margin. They're facing very difficult financial situation at the moment. So it's hard for them to pay for incrementally new expenses. So having reimbursement, I think, is important for the adoption of AI in the US, just like in the UK.
Yeah. So, the NTAP program is really interesting because it is a way for CMS to promote, new technologies and things that are potentially revolutionary. But as you mentioned, it is a temporary code. It does expire after 3 years. What would be the next step after that?
I think the program purpose is to generate the evidence to enable the cost of the technology to be incorporated into the DRG going forward. But we're not counting on that as the only way for our customer to get funding going forward. We see beyond the 3 years, there would be multiple more NTAPs and multiple more technologies of our within our portfolio to be reimbursed, so that we ensure our customer continue to get more the reimbursement into more than a decade or so. So there's more news that we can share in the upcoming months, but we very much have a roadmap approach when it comes to reimbursement, so that it's not just a 2 to 3 years like other technologies before this.
Very good. Now, you mentioned lung cancer screening earlier, and in the U.S. and some of the Western countries, mostly the CT is used for lung screening, but with the use of AI, that has the potential to make X-ray maybe a useful tool as well. Do you see AI supported X-ray as developing a role for lung cancer screening?
Yeah, absolutely. I think just X-ray is a very low cost and very efficient procedure that's available everywhere. So in fact, in the UK, they use chest X-ray as a screening tool to prioritize the patient who go into the CT, because CT have higher radiation dosage, it takes longer, it requires much more resources. So the UK, they have a program called same-day CT, which is when a patient have a chest X-ray, the AI enable the clinicians to flag the patient immediately, so that they don't go home, get a report, and then come back, which could be weeks. But in fact, before they even leave the department, the chest X-ray already been flagged, the patient have a CT right away. So I think it is a very good way to screen the patient that have higher risk of lung nodules on using chest X-ray. In fact, the result that we have seen coming out of Scotland based on our work over the last 3 years, and there's a report by the Chief Medical Officer of NHS Scotland, saying that our technology is accelerating that pathway and earlier diagnosis. NHS Grampian are seeing lung cancer being picked up 10.5 months earlier using our technology compared to previous standard of care. So I think this is a great model, especially when we have limited capacity in radiology at the moment.
Yeah, that's a great idea because in the US, the problem is that the CT lung screening rates are still really low. And, if you can be capturing more people, eligible people with chest x-rays, and then send them over to CT, that's a great idea. What about things like let's say fracture detection? So, X-ray is used so frequently for detecting fractures. What can AI add there?
Yeah, fracture is a great use of AI as well, and I think that is simply within there's many solutions on the market at the moment, and we would looking to either develop or partner with companies who are developing those solutions. You may have seen the announcement of our recent technology, Harrison Rack One, which is a foundational AI technologies that cover all plane films. So not just chest X-ray, but all X-ray, including fracture, MSK X-ray of different bones in the body. So we see that the speed of innovation is increasing, and if we take a view 3 to 5 years from now, I very much seeing a comprehensive AI across all X-ray and across all 3D modalities being available.
Let's dive into Harrison Rad One a little bit more. Now, you announced that a few months ago. It's a radiology vision model. So, can you tell us what is exactly a radiology vision model, and how do you see Harrison Rad One being used?
Yeah, I must stress that this is a technology announcement and not a product announcement because it is such an innovative technology that we want to make sure that we make it available. And in fact, we are starting to make it available to selected researchers and regulators around the world to make sure that they get a chance to see it and experiment with it before we make it more widely available as a product. But what Harrison Red One is a large vision language model. So if you think about that, I see the world of AI and radiology in three phases. First phase is what we call narrow AI that pick up one or two findings at a time. The second phase is where we are now with technologies like Harris and Annalise, chest X-ray and CT brain that is comprehensive, meaning find me everything on a chest X-ray, not a few things. And then when we talk about clinical grade comprehensive AI, like generative AI, like Harrison Red One, it is comprehensive, but you can interact with it with natural language. So you can ask the AI, say, write me a report. What should be the next follow-up activities? Explain this report to a patient who only have high school or middle school education, or explain this in Spanish to the patient. So all the capabilities is now available with Harrison Rack One, and I think it is a very exciting leap in terms of technology. And of course, with the recent guideline from the FDA regarding generative AI as medical device, I think the field is set to explode in terms of the adoption of generative AI as medical device as well.
That really sounds amazing. Is Harrison Rad One something that you see Annalise releasing as a commercial product, or is it mostly something for kind of testing and development?
And that technology already is powering all the product that you're seeing today. So just X-ray and CT frame are in fact powered by our generative AI under the hood, but we just clear that as a standard medical device with a current regulation. But we see that in the future, we would also bring that generative AI technologies as a medical device and as a product into the market when the regulation is available.
No, very good. Now, there was a study that came out using your technology earlier this year. Some researchers from Europe used your enterprise CXR algorithm to analyze chest x-rays, and they were able to rule out more than half of the normal chest x-rays, basically just saying, hey, this is normal. You don't need to look at it, or you don't need to look at it right away. What are some of the implications of a finding like that? I mean, how would that functionality be used in clinical practice? Could radiologists at some point just maybe not look at those ever, or is that just sort of too far down the road?
No, I think that is the next 12 to 24 months, Brian. I see that is where the world is heading towards in terms of AI enabling ruling out of normal cases, either in X-ray or in mammography. Because given the capacity shortage that we're having at the moment globally, clinicians want to focus on patients that truly need their help. And we are inundated with volume, and a lot of that volume are normal cases. But it is a very difficult thing to do to call a case normal, because when you call something normal, you need to rule out everything. So in fact, that is the most difficult task in AI in radiology, is to screen for everything. Are you sure you're not missing anything on that chest X-ray or anything that I should be concerned about? That's why I think that is the ultimate test of an AI. And I truly believe that you need to have an A to Z solution, because if you have an A to B solution, how about the EF? Or how about other things that you don't look for? Is it truly normal, or just because you don't look for those? So I think having comprehensive AI is essential for having normal AI technology. And that's a study conducted in Denmark, and that was done independent of us and the researchers using that in various settings, in acute setting as well as in outpatient setting, to be able to prove that the technology is ready today. Of course, it's also there's regulators and there's different guidelines from different societies in different countries to enable such a workflow to happen. But we, in different parts of the world, we already see that workflow being implemented today in terms of automation of normal or near normal cases, because that is the only way I see we can cope with the capacity gap that we have today in radiology.
Yeah, and some of the volume of images that can be ruled out is pretty stunning. I mean, it's there's a lot of images, so it'll be really exciting to see where that goes. Now we've got RSNA coming up in just a few weeks, and Annalise will be exhibiting there. What are some of the highlights that we can look forward to from Annalise there?
Yeah, we're very excited that our Just X-Ray and CT brand now has been in the market for 2-3 years. And what we're seeing is a large adoption on a system-wide. So it's no longer innovators adopting the product. If you think about the early days of AI, it is one center, one hospital, one university adopting the product. As we're celebrating 5 years of our foundation as a company, we now have more than half of our radiologists in Australia using our product. We have a third of NHS England using our product. We have all the emergency department in Hong Kong using our product. So we're seeing a really large scale adoption globally of our technologies for just X-ray and CT brand, which is something that we're very keen to talk with clinicians and sharing the real world evidence from those deployments. That's number one. Number two is we are announcing our CT chest product and sharing information about how comprehensive CT chest is also possible. I remember when we were starting out, there was a lot of doubt about whether just X-ray comprehensive AI A to Z is truly possible. I think we proved that back then. We have proved that again with CT brand, and now we do it for the third time with CT chest. And the third thing is to continue the conversation that we're having on this call, which is about generative AI. I think that's going to be a buzzword at RSNA this year. But clinicians are very savvy. When they try to put some cases on GPT, they know that there's a lot of risk of hallucination, and why the report is being generated by a generic model like Gemini or GPT can sound like a radiology report. It contains many errors because it was not designed to be clinical grade. So we are very excited to demo our Harrison Red One technology to researchers and clinicians to show that this is the next frontier where AI can truly performing at clinical grade level for radiology. And finding partners, I think, for us to partner with in bringing this to the market.
All right, very good. Well, I'll look forward to seeing that. Well, some great discussion today. Dimitry Tran of Annalise.ai and Harrison AI. Thanks so much for being with us.
Great to be with you, Brian.
All right, signing off for the Imaging Wire. My name is Brian Casey.